Um, I know that was one hell of a rally that many of us just went to. Congratulations to all of you that made it and made it back. You know, expanding labor rights is important in and of itself. We all need rights on the job. But expanding the labor movement is important for another reason, and that's because without the labor movement, we wouldn't have Social Security. Without the labor movement, we wouldn't have Medicare. And without the labor movement, a nice, strong, good, energetic labor movement, organizing heavily, we won't make progress in what we're going to be talking about today, which is health care for all. Now, our European friends who are here at this conference think that Americans are just crazy. That we're in the U.S., yeah, maybe we are, that we're having to fight for universal health care. When in Europe, even the conservatives have accepted that long ago, and they vie to see who's better at improving the national health systems that they have. Here in the United States, that is part of our social democratic legacy that we are still fighting for and may be in part responsible for new social democratic victories in the elections to come. Finally, after 2 decades after the Clintons tried and failed, health care for all is back on the political agenda. It's back on the front burner because the American people in the last couple of elections have put it there. And there's something good about elections. It forces politicians to talk to the people. It forces the politicians at least to talk to pollsters who talk to the people. And, you know, in the last election, politicians, especially Democratic politicians, made a big deal of how the drug and insurance industries ripped off the Medicare prescription drug plan, literally writing it and bypassing Medicare and putting the insurance companies in charge and preventing the government from negotiating decent prices. A good capitalist idea that when you're buying a lot of widgets, you negotiate for the best price. When you're buying a lot of health care for your company, you negotiate for the best price. Here you've got to take whatever the drug companies allow us, sell us. It's a massive windfall for the drug industries. So the election campaign focused a lot on that and on some candidates who talked about health care for children. There were a few Democrats like Heath Schuler and Jim Webb and Ned Lamont and Donna Edwards, who ran for office this time, who talked explicitly about health care for all. And some candidates talked about a more modest goal of insuring children. But the polls that were taken after this election showed that even though it was an election mostly about Iraq, the number 1 or number 2 issue on people's minds was health care. MoveOn.org polled all of their members. You think of MoveOn as an anti-war organization. The number 1 issue on their minds was health care. So this is the reason why in the next election we believe that health care for all and the health care crisis, as many people experience it, is going to be one of the top issues. Now, the polls show that people see the health care system as in crisis, but many people, different people experience it in many different ways, that crisis. There's some 46 million Americans who have no health care insurance at all, 16% of the whole population. 8 million children have no health care in America. That's 11% of American children. And it's the sad reality that these numbers are getting worse every year. The rest of us who think we have good health care or think we have coverage through our employers or on our own often find that when we need a doctor or hospital care, our health insurance companies won't cover the condition that we need treated. We have to pay thousands of dollars out of pocket in co-pays in order to get decent treatment, or that we can't get decent preventive care under our health care plan, or that we fear that losing a job or losing one job in the family is going to lose our health care, is going to throw us into bankruptcy if we experience a health care crisis in our lives. So in all of these ways and many more, we are experiencing, the American people are experiencing a health care crisis, and it feels like the whole system is dysfunctional. The costs of yeah, right, all right. That's why it feels that way. All right, so the costs are really driving our whole budget problem. If we solved the healthcare crisis, we would not have a budget problem in the United States. And most people understand that the solution to this crisis is going to require government action to create a good system, healthcare benefits at affordable prices in a way that goes beyond what individuals and large and small businesses can do on their own. But people also understand that we've got to cut out or greatly reduce the political power of the drug and insurance industries if we're going to do this right. So that's just a parallel educational process that we're going to have as we talk about healthcare for all. And I think Michael Moore's new contribution to cinematic art is going to really drive that debate. And he's going to be here tomorrow to give us sampling of what he's doing, basically looking at how the health insurance industry kills people. So part of our job is to acknowledge what everybody knows, that we're up against serious special interests. The other part of our job is to advance a demand for a health care plan that doesn't just put those drug and insurance industries in the catbird seat once again. That at the very least, and Diane is going to go into this more, we need a health care plan that has as its core a Medicare-like guaranteed public plan that at the very least is available to everyone, and at the very least is the default plan for all people who don't have health care. Now, there's been a lot of work, thank you. There's been a lot of work about, how people think, and one of the realities, as we saw with the Harry and Louise ads, is that some people have very good health care and want to keep it. Thank you very much. So we think, many of us think, that the principle of choice, the principle that you can keep what you've got, but if you need help, if you need an alternative system from the private healthcare system, it will be there for you. So that's one way to bypass the Harry and Louise problem. We, at the Campaign for America's Future, plan to organize a multi-pronged campaign, just like we did on saving Social Security. We will organize a nationwide citizen-led discussion, hopefully involving all of you in this room, around the health care crisis in every community in America. We did that on Social Security. People are even more eager to do that on something that is positive, that will benefit their communities. And we'll discuss the role of the private health insurance and drug companies in that discussion. We will also organize to demand that every politician running for office show us their plan for health care for all. We heard some of that today from the two candidates that we heard from. Senator Edwards has been especially forceful in pushing the whole debate forward, and we want to use that as a useful competition among the candidates. This is the most powerful point of leverage that all of us have on the healthcare debate. Finally, and we will also put forward our own progressive plans for achieving health care for all. We and the Economic Policy Institute have published a plan by Jacob Hacker. You can find it on our website and on EPI's website, which incorporates this principle of guaranteed choice, this principle of a public plan that you are able to choose. But we think that everybody who has a plan, whether it's single payer or whatever it is, ought to be out there advocating for a plan that they think does the job. And that process of advocate and pushing our vision of a health care plan will move the entire debate. And finally, having made health care for all a defining issue in the 2008 elections, that's not the end, that's just the beginning. It's going to take the first term of whatever president gets elected, and if they're smart, they're not going to do what Hillary did and get a bunch of smart people in a room and come out with their health care solution. They're going to have a dialogue, a debate, a discussion with the American people using the bully pulpit of the White House to really make sure that when we go forward to the Congress, people understand what we're talking about and people are willing to fight for it. So we have a big, big job. But, you know, we've never shied away from big jobs. We think that this is the time for health care for all. And we are going to organize a coalition of all of the groups in this conference, all of the groups that were up on the Capitol Hill rally today. And we are going to make a movement for health care for all to happen. Now, I want to introduce Diane Archer, who's become a partner in this effort. She is a nationally known expert on health care. For over a decade ago, she founded Medicare Right Center, a group that's counseled tens of thousands of older and disabled clients while shaping the national agenda on health care. We are very, very honored that she has become a special counsel to the Institute for America's Future and is helping to direct our Health Care for All project. Diane.
Thank you, Roger. Good afternoon, everybody. I am so delighted to be here and honored to be working with the Campaign for America's Future on Health Care for All. Okay, so where are we in our movement and where do we need to head? What's great is that there are so many of us now focused on improving the healthcare system, from addressing the needs of the uninsured, to coverage for kids, to strengthening Medicaid, to state initiatives to get everyone covered in a particular state, and the beginnings of a movement to de-link coverage from employment. And now we also have a movement that brings all this great work together at the national level that focuses on guaranteeing all of us, working families, the uninsured, the kids, good, affordable health care. Kucinich, Edwards, and Obama are helping this movement with their health care reform plans, and Michael Moore, as Roger just said, already has given it a major boost with his not yet released film, Sicko. His focus on the underinsured and the at-risk insured, a group that includes the overwhelming majority of Americans, most of us in this room with insurance, who are one job loss away from being uninsured and one sickness away from realizing that the coverage we thought we had doesn't give us the protection we need. The important point is that the good insurance we think we have too often forces us to spend more than we can afford on health care if we become really sick, and may force us to forego necessary and important care or push us into bankruptcy. Moore's film, based on what I know about it, gets at the heart of this problem with our healthcare system. What is it? The for-profit health insurance industry. The problem is that even when it's heavily regulated, and I know this from my work with Medicare and the Medicare Advantage, the private plans, for-profit health insurance puts us all at risk. What's interesting is that there's almost unanimous agreement among the public, Republicans and Democrats alike, that our for-profit health insurance system isn't working. It's broken, it's dysfunctional, as Roger said. It's too expensive, premiums are high, out-of-pocket costs are astronomical when you most need care. It punishes the sick by forcing the sick to pay more when they most need care and are least able to afford it. It too often fails to cover care we need. It's too uncertain, since it's linked to our jobs, and it's too risky, providing no guaranteed security, often when we need it most, when we or a spouse or a child is diagnosed with a complex condition and needs expensive care. You all know the horror stories. The hard-working American who works 2 jobs, pays taxes, plays by the rules, whose kid has a rare blood disorder, and because his insurance covers only 90%, hear that? Only 90%. It's an important only 90% of the cost of the care his daughter needs. And there's no limit on his out-of-pocket costs, but rather the opposite. There's a limit on the amount the insurance company will pay. The family, with what they believed was great health insurance and a healthy $70,000 annual income is pushed to file for bankruptcy. You know the statistic, half of all people who file for bankruptcy file because of a medical need, and most of those people have insurance. The problem really is the for-profit health insurers, because it's their business to make money, and they make money by setting up systems that avoid covering the people who most need care, or shifting so many costs to them that they can't afford the care they need. Think about it. When was the last time you saw a health insurance company ad that said, "We want you if you have cancer"? We have the best cancer program in the world. Never, right? And there's a reason. They don't want to have the best cancer program in the world. And even if they have a good cancer program, they don't want you to know that, because more people with cancer will want their insurance, and that will eat away at their profits. That's a problem. In short, these insurance company businesses do not compete to provide good coverage to the 10% of the population who use about 70% of health care dollars. They do everything in their power to avoid us. So what's the solution? The unifying solution that underlies all our health care reform initiatives is public insurance. Just to be clear, it is not socialized medicine or government-provided care or the British system. Those systems involve governments as employers of doctors, employees, governments owning hospitals. We're not talking about that. We're talking about private doctors and hospitals with the government administering insurance. It starts from the premise that much as with our schools or the environment, it is the government's responsibility to guarantee us health care, and that it can do so by providing us with insurance that allows us to see the doctors and hospitals of our choice. How does it work? It could work like Medicare, with a good benefit package like the one members of Congress has. As some of you know, I've lived and breathed Medicare for almost 2 decades, and while it is not perfect, I can tell you that its genius lies in its design. A design that automatically covers you, doesn't make you fill out forms to become eligible, distributes costs equitably, everybody pays in across the country the same premium, reins in costs by negotiating on behalf of tens of millions, and protects you from financial risk if you become sick and need a lot of care. All of these elements are key to a good, affordable health care system. And just to say it, with Medicaid, which is a great program for the poor, I think the numbers are that the percentage of people who are eligible for Medicaid who are not enrolled is something like 30%. With SCHIP, the state Children's Health Insurance Program, again, it's about 30 to 40% of eligibles are not enrolled. The system is basically designed to fail the most vulnerable people. You need automatic coverage so that the most vulnerable don't fall through the cracks. Okay, so we know what we don't like, for-profit health insurance, and we know what we need, public insurance. The question is, where is the public? And the good news is that Celinda Lake, one of the leading Democratic pollsters, her polling is showing that 80% of the public, yes, even the so-called proper patriots, the white middle-class Republican men, really are with us or could be in supporting public insurance. They are not all ready to be forced to give up the private insurance they have, but they do support a choice between their private insurance and a guaranteed affordable public health insurance system. While it would be great to eliminate for-profit health insurance altogether, if we ended up with a system that gave people the choice of keeping their private insurance or opting for public insurance, there's good reason to believe that over time, most of the public would opt for that public system, since it can rein in costs and offer far better affordable coverage. Now, I can tell you that today, for example, there are more than 80% of the Medicare population is in the public traditional Medicare program without the private insurer middleman, and only 19% is in the Medicare private option, even though the government is subsidizing and overpaying those private plans substantially. So if there were a level playing field, I don't think there would really be much competition. I think we'd see almost everybody over time moving into that public plan. There's more good news. We've already moved the debate beyond California and Massachusetts to proposals from candidates that reflect a need for public insurance. A lot of credit here goes to Roger, who's done an unbelievable job at getting the Obama people and the Edwards plans to include public insurance. And in the case of Senator Obama's proposal, public insurance is the automatic default for people without coverage, ensuring that everyone gets covered and no one falls through the cracks. We certainly don't want to be driven by what the pollsters are telling us, but in large measure, Celinda Lake is telling us what we want to hear. We have overwhelming public support if we give people a choice between public and private insurance, require everyone to take responsibility and contribute their fair share, and offer people a benefit package that they can understand and that protects them, gives them peace of mind, gives them health security. What do we need to do now? We need to keep that discussion going. We need to get people to understand how the for-profit insurers are never going to get us where we need to be, and why public insurance needs to be a piece of the solution at a minimum here. It addresses the we need to keep hammering home why we need public insurance. It addresses the array of challenges we need to address: the uninsured, the kids, the poor, and the underinsured. At the very least, we need to make sure that the Democratic presidential candidates include public insurance in their health care reform proposals, and we need to enlist business in our efforts and show them why public insurance works for them. For that, I am delighted to report we have the help of Ned Lamont.
And this is a guy who needs no introduction to this crowd, but I'm going to give him one anyway. You know that in '06 he frustrated with Joe Lieberman's continued support for Iraq War, but also his continued support for things like privatization of Social Security. Ned launched a people-powered campaign for the U.S. Senate that won the Democratic nomination. And in so doing, sent a historic signal to every vacillating Republican tilting Democrat running for office in a Democratic state, that their nomination was in trouble if they didn't act like a Democrat. So it's a lasting legacy, I'll tell you. And only the complete collaboration of the Republican Party allowed Lieberman to win. Ned has returned to his company, Lamont Digital Systems, and in that capacity as a longtime businessman, he knows a lot about the pressures and the financial strains that businesses, large and small, are facing with this healthcare system. So he can tell us a lot about that. And we're very lucky that he has agreed to work with IAF to continue his pledge, made in the campaign, to work for healthcare for all. Ned Lamont.
First of all, Roger, I love getting back here to Take Back America. You're out there in the vineyards toiling away for 365 days. You get back here, and it's a little like legal steroids. You hang here with your fellow progressives, build up your muscle mass, get your energy back, and ready to do battle again. And Donna, I got to tell you, I've got no problem taking on a multi-year incumbent, even if they're of our own party. If they're not getting the job done, hold their feet to the fire. And Diane, I'm looking forward to working with you closely as we try and make healthcare reform and universal healthcare affordable for all Americans is a priority for this country, and make sure the presidential candidates take a good hard look at what we got to do for folks. Look, as I traveled around the state of Connecticut last year, I put on about 40,000 miles in my Ford Escape Hybrid in about 6 months. And yeah, it was a lot about the war. And the people of Connecticut got it. They know it was the wrong war. They knew it was hurting our country. It was destabilizing the Middle East and making our country less safe. But the people, especially the folks in the primary, got that. We didn't have to have as much a debate about that. You know, as Roger said, we spent a lot more time talking about health care. And it was the workers up at Sikorsky who were being asked to pay more, and they're going to get a lot less health care. It was the guys at Stanley Works who are losing their job, and as Diane said, you lose your job, you're losing your health care. This is a family of 4. They got a sort of Damocles hanging over their head. And if you're not at Stanley Works, you feel like your job may be the next Stanley Works. You didn't know where you were going to be. And I just can't understand it. I mean, we've been kicking the can down the road for a long time on health care. And it just seems to me now is the time for us to be stepping forward and doing something about it. And America never used to be this timid. I mean, what is it? We seem to be so reckless in our foreign policy. And we're so timid in our domestic policy. Like I said, it wasn't always that way. I mean, you know, FDR, he had a Social Security plan. And he put that into place and he made it happen. You know, Ike, he had a national highway system. Today, that would be a $1 trillion infrastructure project interconnecting all 48 states. LBJ was Medicare. Even Dick Nixon. How many guys have quoted Dick Nixon at your conferences over the years? You know, Environmental Protection Agency. Yep, there was a sense that we had a government that was meant to do things. And right now we have a government that's sort of kicking the can and trying to avoid these things, and it's wrong. And I've often said, they said, Ned, you're a business guy. What are you doing as a progressive? I say, look, if you're an entrepreneur in business, you're a progressive in government because you see problems and you want to solve them. And this is a problem that's burdening our country in so many ways. You know, as I traveled around, it's, you know, it was just a variety of different things that caught your imagination and things we ought to do. I mean, we know the facts of the case. We know the system is broken. We know it's 47 million people without health insurance. We know our costs are going up at 2 to 3 times the rate of inflation. We know that's bankrupting working families. It's bankrupting small business. And pretty soon it's going to crowd out government and bankrupt government unless we do something about it. And the question is, how come we're not able to get there? Where's the will? Where's the energy? We had it a generation ago, and why don't we have it today? Well, look, as I look at the problems out there and people try and stick it into different buckets, they say it's the question of universal coverage for everybody. No, 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 first we have to deal with cost. No, 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 we have to deal with quality. As if these are 3 separate issues. They're all part of the same problem. You know, we know that as long as we have people who are uninsured or underinsured, and we're not taking care of prevention, we're not taking care of testing, we're not taking care of diagnostics. They're waiting till they're sick, they're waiting till they go into the emergency room, they're waiting till they go into the hospital. It's the most expensive type of health care we can burden our folks with. It's a system that's broken, as Diane said, and that's why it's so imperative that we put this in front and center. And yeah, I think that the plan that you know, Center for American Progress makes an awful lot of sense when they talk about allow people an option, give people a choice. You know, for those who say, look, we have a private health care system and everything the government touches turns to mush, they'll have their private health care system. It will require a core benefit. You're not going to be able to discriminate against anybody with a pre-existing illness. We're going to make sure you have prevention and diagnostics as part of what it is. We're not going to have health savings accounts. And what they do is they discourage people. They give you disincentives from going in and taking care of things while they still can be taken care of. At the same time, I think people like Medicare. As I traveled around the state of Connecticut, people understood. They knew what Medicare was. Look, I know I can describe Medicare as a large public pool that takes the risk in a broader way, but people don't know what that means. You know, I think Medicare is a word that resonates with people. And I think giving small business, giving individuals an opportunity to buy into Medicare is a competition at its finest. You know, I know there's a fair number of folks out there that says there's no way that Medicare is going to be able to compete with the smooth efficiency of our privately run healthcare system. God bless them. They'll have that chance to test it. As a business guy, I like competition. I have a feeling that we reduce those administrative costs, we give people an option, we negotiate drug prices, we deal much more with prevention up front. We're going to be able to save people an awful lot of money. My God, do you realize that we spend twice as much per capita as any other country on the face of this earth? Twice as much per capita. And when it comes to quality, yeah, talk about how do you measure less? How about longevity, how long we live. We're 29th. We're 29th in the world right now in terms of longevity, right behind Bosnia-Herzegovina. I think we can do a little better than that. And I just like to say, there's one word that in the business world, I don't hear a lot about. It's an extreme idea, or I'm a centrist, or I'm a moderate. Sometimes in the business world, moderate and centrist means incremental and not making a difference. When I look at broken systems in the private sector, one of the first that comes to my mind is General Motors. And when you talk to an executive recruiter, you say, what type of a leader do you need for General Motors? And they don't say, oh, I'm looking for a moderate who will help us fix this. You're looking for a bold visionary who's willing to step forward, come up with a vision that'll help us save that industry and keep good-paying jobs in this country. And I'd argue to you that our healthcare system is the General Motors of the public sector right now. And it's time for us to step forward. It's time for us to have some bold leadership there. It's time not for us to be shy. And I think if we hold our politicians' feet to the fire, we tell them it's cost-effective, we tell them it's fair, and we tell them we're going to get better quality for it, let's give it a shot. Thank you. Thank you.
Thank you, Ned. Donna Edwards is known to many of you here because she's funded you. She's a longtime executive director of the ARCA Foundation, and she's helped to support many of the groups that are here at this conference. Her longtime work for clean money campaigns and issues like healthcare and the environment had led her to put her money where her mouth is. And we hope that you'll put some money into it too, because she declared last year to run for Congress to represent the people of the Maryland 49th Congressional District. The 4th Congressional District. Let me get that straight. The great news is that she has announced that she is running again. It was a very, very close election, and this time it's going to be even all the way. And if I'm allowed a personal comment, this might be a good time for Mr. Wynn to announce his retirement. It's a good time for you to make contributions to her campaign. Donna Edwards.
Couldn't ask for a better plug than that. It's really great to be here, and to be here. First, let me put my foundation hat on from the ARCA Foundation, because we have been a long, proud, strong supporter of the Institute for America's Future, protecting Social Security, looking out for working families, and now is really aggressive leaders on this healthcare campaign. So thank you for your leadership, Roger. It's fascinating because, as Roger just said, I ran for Congress last year. I'm running again, and I remember being described as Maryland's Ned Lamont. Now, Ned and I don't look anything alike, but we do both have that short, manageable haircut. So like that. But I have to tell you, during the campaign season, healthcare came up all the time. But I want to share with you a story about a woman and her experience of our healthcare system. As a young child growing up, she was in the military healthcare system because her father was in the Air Force and had great standard bearer service in the military with her siblings, 5 siblings. Can you imagine, on a military enlisted salary, paying for health care coverage for 5, 6 children later on? And then moved from there into college, still under her parents' health care coverage. And then college was over, and there was that blank period, and you all know this. And parents out on the campaign trail talk to me about this, where, sort of in between college and that first job where they could really afford health care, they just said, you know what, it's just not worth it, I'm not going to do it, and crossed their fingers that nothing would happen. So this was this woman. Then, she had her first child out of law school, 33 years old with a 3-year-old, separated from her husband without insurance and very meagerly employed. She went to one of those critical care centers to an urgent care centers to take care of her, son's sort of daily needs, not so bad, a cold here, a cold there. Then one day, she had a cold. It got worse. She couldn't go in and get it taken care of because she didn't have health care. And then one day, she kind of keels over in a grocery store. And it turned out that she had walking pneumonia and ended up in an emergency room on a respirator. Again, remember, she doesn't have health care. And thousands of dollars later, she was feeling better. But she had to pay that thousands of dollars back over some period of time. And that woman's me. That was my story. And so now it feels great. I'm at the ARCA Foundation. I have a wonderful, wonderful health care plan. I mean, it's like the Cadillac insurance plan. But I know that lots of people out in our communities across the country don't have that kind of health care coverage. And so just a couple of years ago, my son, playing basketball, went up in the air and, like people do, came down on his head. It was really bad. Sprawled out, it was, the worst of all possible moments as a parent. And so with that Cadillac insurance plan, we rush into the emergency room. He's ordered to then have an MRI. They couldn't really quite do it then because they were backlogged. And there was another MRI center, 24-hour MRI center. Would have been quick, would have been less expensive. And instead, the insurance company, because, they had the control over where you get the coverage, said, nope, you need to wait in the emergency room and get the MRI done there because we can't really authorize you to have it done at this 24-hour center. The MRI actually ended up costing double what it would have cost had we been able to just go to the 24-hour center. But, why should I worry about that? Because, after all, my Cadillac insurance plan paid for that doubled MRI coverage. And so this is what we face as Americans, throughout the system. Sometimes we're with, decent care, and then we're without care, and then we have Cadillac care, and then we decide we want to change jobs, and we may have no care at all, or it may be different care than we had before, or we're getting older, and so we've got those pre-existing illnesses, and we're not covered in the kind of way that we used to be. I think that this is unacceptable. And when I was campaigning, people would talk about health care all the time. And the irony is, they talked about health care in the context of the war. Isn't that amazing? And what's the reason? Because they said, my goodness, if we can spend $10 million a week or whatever the estimates are, paying for a war, can't we afford to pay for health care coverage for all Americans? Can't we do that? And so I'm really excited both to get back to it, but also to join with the campaign and with people across the country to have a real conversation and a dialogue about how we can provide affordable, quality health care coverage for all Americans. It shouldn't matter that I'm at the ARCA Foundation or no foundation. I should have health care coverage, and so should my child, and so should he as he's going through college now. And we shouldn't have to worry about, whether we want to, have passion and want to keep our jobs. I mean, when I didn't have health care coverage, I was going to work every single day and didn't have health care coverage. And I was passionate about my job, and I had to quit my job so that I could go find a job, another one I was passionate about, but one where I did have adequate health care coverage. Those are not decisions that we should have to make as Americans, not in this country of such greatness and such wealth and opportunity. This is sort of a baseline that we should be able to do for all Americans. And so I'm very excited to actually join in this, in this battle, in this conversation, in this dialogue about how we can do, not just for some of us who can afford it at the top end, but for all of us from the bottom and the middle too. And Americans, I think, and I know in my congressional district, want to have that conversation. For those of you who don't know our congressional district, it's just outside of the District of Columbia in Maryland. Prince George's and Montgomery County. And in Prince George's County right now, and I see some of our constituents out here, in Prince George's County, we have what amounts to now a public health crisis in what is sort of a private hospital, but maybe a public hospital, but it's a public health crisis, and it's brought on by a huge amount of uncompensated care that's taken care that comes into that hospital, and the skyrocketing cost and the inability to sort of match our capacity with the need in that healthcare system. And so the impact isn't just to individuals, but it's on systems. And our system is completely broken, and it's failing so many of us. And if it doesn't fail you today, it's going to fail you tomorrow. And so that's the reason that we need to deal with this crisis now. And as concerned as I am for all of those people who are uninsured, 47 million, we can double that number for those of us who are woefully underinsured and frightened every day that something is going to happen that will just take the bottom out from under. And as Diane said, that bankruptcy results, really the majority of bankruptcies, when people are facing major healthcare crises. And I know that, speaking personally, I was probably just a step away from that bankruptcy in my own experience. And so I know I would like to be able to discuss healthcare as a policy analyst or a policy maker, soon to be doing that, or somebody who just sort of knows the system from a theoretic standpoint. But I don't discuss it like that because I know it from my own personal experience. And I know that but for a decent job with the Cadillac coverage, I could be without coverage at all. And I'm on my own. Like many women, and especially as we age, we're on our own. And we can't leave it to the system to be up for grabs in our own health care coverage. And we need preventive care. I was at a health care fair over the weekend, and there were lots, it was a low-income community, and it turned out that there were lots of people streaming through who were getting eye examinations and ear examinations and glaucoma testing and cholesterol testing and their blood pressure, and they were people streaming through because they didn't have health care. And this health fair that was there enabled them to just get basic diagnostic and preventive services. And so we shouldn't depend on a community health fair in order to make sure that all Americans have access to quality, affordable health care. And so thank you all so much for our activism and all our leadership in making this happen, because when we create this conversation, we don't leave policymakers with a choice but to give us the kind of progressive public policy around health care that we all deserve. So thanks so much to you all for your activism and your leadership.
I want to give Donna Edwards just as good a health care plan as they have in the U.S. Congress. And the same for the rest of us. We want to have a dialogue now. Robert, we have about half an hour to go. Pardon? 27 minutes. We have microphones here, and so let's just have a free-flowing discussion. I'll moderate.
Okay,
yes, sir. Say your name and where you're from.
Guy Saperstein from California. All of you haven't explicitly said so, but you seem to be trending toward a single-payer Medicare for all system, which I think is fine. But one of the biggest criticisms of single-payer is that it's just too different and too big and too much to grab at one time. But Medicare for all single-payer can be expanded incrementally in many ways, just like as any other system can. It's always seemed to me the most obvious place to start would be with children. It's harder for the insurance company to fight that. Insuring children is fairly inexpensive because they don't get sick as much as older people and so forth. All the plans that we're seeing from the presidential candidates seem to be incremental in one way or another. And so I'd like comments from any of you on the panel about the way we can proceed toward a Medicare for all system incrementally, if not completely, and what you think about the plans that have been offered so far by the various presidential candidates.
I'll start off. I think that the different presidential candidates, as you say, offer ways to get us to a system of Medicare for all. The Obama plan, for example, while it lets people keep the insurance they have if they like it, private insurance through their jobs or however, it also gives people the choice of public insurance. And I think my sense, although who knows, the private health insurance industry is going to complain and do what they can to undo any movement for change. But my sense is it's hard for them to say, we don't want you giving people the choice of insurance when they're people who don't have insurance today. And so if you went with a plan like Obama's, or even Edwards also has a plan very similar, the difference being that the Edwards plan focuses on regional pools and not on a national pool, which is what the Obama plan does, you would get slowly to a system, potentially, if the public insurance were good, if the Medicare-like system worked well, where more and more people over time were signing up for it.
The only thing I'd add is structurally, we're getting there in steps because we leave in place the private healthcare system and give people a public option. But I think the bigger issue is, at the end of the day, it saves us money if everybody is covered. So it doesn't make any sense to cover just a few more people on the grounds that that somehow is a cost savings. That takes us in the wrong direction. We want people to be incented to go in and have those diagnostics and tests at an early age. So we can play a lot of games and start reducing the age of Medicare and the such like that, but at the end of the day, that doesn't really make the situation better.
I would say that we have a spectrum of proposals out there. On the right end of the spectrum is Massachusetts plan, the Schwarzenegger plan, which basically are trying to use the private sector exclusively while discovering that they have to regulate the hell out of them. They have to figure out a way to force the private sector to do what their business plan doesn't allow them to do, which is insure everybody, non-discrimination, without pre-existing conditions, et cetera. That requires an incredible regulatory apparatus. Then you have the single payer, which it would be great if we could turn a switch and tomorrow we would have a fully functioning single payer plan and private health care was relegated to the diseases of the rich. But in what we're talking about and what the discussion with the presidential candidates is somewhere in the middle. They are still trying to regulate the private sector, and that's going to be an educational process. All of them are talking about regulating the private insurance companies who want to play in their system, and they are also, we have prevailed upon them, I think, to offer a public plan like Medicare that in the Obama case is sort of the default. So it would be great progress if we could get the political system to really grapple with the kind of Obama-Edwards healthcare plan. But people who believe in single payer should keep on advocating for the principles behind single payer because they are very valid.
I mean, apart from the validity, I mean, I think it should be really clear that we need people advocating for single payer because what we'll get in the end, because we all understand the process, will be marginalized if we don't have really strong advocacy for single payer. And I mean, I just think we have to move, steadily and quickly and boldly to make sure that we get the insurance companies out of medical decisions. We get the insurance companies away from these, personal health care decisions that ought to be made by doctors. And I think it does require some boldness. And it may be, a set of steps that get us there. When I talk to small business people, for example, in our community, they want to be able to buy into a Medicare system. They recognize that it's, that it's less expensive for them because their employees are people who are in our community. And they want to be able to do something for them. And maybe that moves us along some baseline that gets us away from a solely employer-based system. But I think that we shouldn't make assumptions also about the business community because not all the business community is in exactly the same place about this. And so I think we have some allies and advocates in places that we don't expect.
Yes, sir.
David Rabin, Georgetown University. We're driven to have this debate and people to participate in it because there are enormous problems in terms of the cost of health care. Our solution to this cost nationally is by and large to increase premiums and decrease coverage. This means basically that a higher proportion of the population that is covered is inadequately covered. They are underinsured. They use services like those that are uninsured because they're fearful of the $1,000, $2,000, $3,000, $4,000, $5,000 they have to pay out of their pocket before they get insured. The plan that one is talking about in terms of trying to have a public plan which is competitive is admirable, and incrementally it would be an improvement. We have gone through 60 years of incremental improvements in the United States with an increasing number of uninsured and an increasing number of underinsured. We now have the experience since passage of the Medicare reform of basically having an increasingly privatized Medicare system. The principle there is that if you have a public system regulated through Congress, it can be subverted by a Congress that is not sympathetic to the idea of a public system. And we have gone very far for all of those people. 60, 70% of people who are drug insurance under Medicare are privatized. A rapidly growing percentage mentioned was 19%, should be 22% within, or expected to be within another year, are basically going to get private insurance under Medicare. The most popular, rapidly growing portion of that is private fee-for-service. And ridiculous because of the fact that you're basically applying privately to get a benefit which is less than you're already being paid for publicly and being paid 20% more in order to get that. So I would say that we are all best off if we advocate clearly and unequivocally for what is needed. What is needed is a single-payer system, Medicare for all, and not something which is only approaching that on an incremental and uncertain basis. Thank you.
Let me respond briefly, and others can too. I think that it is very important for single-payer supporters to be out there advocating and pushing a complete vision for health care. At the same time, I think it's very important that all of us be fighting this Medicare Advantage plan that has a chance of getting all of those subsidies wiped out, gotten rid of this year in Congress. So, yes, of course, the price of liberty is eternal vigilance. When we have a Congress, they always have the potential of subverting every single possible plan, and they are trying to subvert Medicare right now. You're absolutely right. Anybody else?
I like to do things that we can get something done on in a short period of time. FDR tried for a single payer. Harry Truman tried for it. Hillary had an incremental approach to it. I think the idea that Medicare is an option for everybody is something that we can get done. I think, as Donna said, I think you can get the business community lined up alongside of labor and consumers, and I think it's something that we can really see in the next couple of years. So I'd like to start with a possible.
Yep.
Hi, I'm Merrill Guzner with the Center for Science and the Public Interest, and I blog a lot on healthcare issues at goosenews.com, and I am a resident of the 4th District in Maryland, and even wrote a check in the last election, and it wasn't to the incumbent, and I rarely do that, I assure you. I'll frame the question first, and I want to just lay out a few facts and try to make this very, very brief. The question is I think we need to get the issue of health into the healthcare debate, because if we don't deal with that, we're really basically trying to come up with an insurance system. And historically, I'm all single payer. Wherever you want to go with that, but the reality is like having a great ambulance show up at the car crash is not the best way to get better health outcomes for Americans. And that's really what our insurance problem is all about. That's the ambulance, and we got to talk about the car crash. One quick study as background, the top third of Americans have worse health care outcomes than the bottom third of Britons, and it isn't because they have bad health insurance. So, there's a lot of things going on. We have an obesity epidemic in this country. We have a lot of people on the way to chronic disease that are not being reached, where the sort of diagnostics and preventive care that you can structure in a health care benefit doesn't really reach those people. We have to come up with new and creative ways of building the issue of health into the healthcare debate. And I have some thoughts about that, but my question to this panel is what are your thoughts about that? How do we do it?
Good question. I don't see how we do it except with public insurance. because it's the public insurance that takes on health care as a social responsibility, and the public health can be taken on along with it if the government so chooses. Private health insurers are simply in the business of doing what they need to do or can get away with to provide coverage to people. And so if you're looking for a system that's actually focused on disease management, chronic care management, preventive services, and the public health, you need to start with a transparent public system, not one that's caught up in business trade secrets and proprietary information.
Anybody else? Yes, sir.
Yeah, I'm Jim Hansen. I organize in Idaho, and I want to suggest that we should include in our debate, be very intentional about including small towns and rural America. That's where Harry and Louise resonated. But in organizing in small towns, you realize that health care defines the health of that community. Now, you can come up with a lot of stories, examples. People will tell you, this community started to die when the doctor left, when we didn't have enough to support a clinic. And these clinics were paid for in the 60s and 70s with public money. So in rural America, they totally get public investment in infrastructure. They totally get investment in rural electrification, reclamation for small farms. We're surrounded by national forests in the West. They totally understand there is a legitimate role for the federal government to play for the economic security of our communities. But by and large, small towns are left out of that debate, and small businesses struggling to survive in those little towns are left out of the debate. So I would urge you to be very intentional about including small communities, rural communities, communities in all of our red states in the center of that debate, so that when they react, because they will react to the insurance companies, they'll go right back to their base and try and scare them away. And we'll already have done the organizing. We've got the advocates in those communities, and they say, no, this is going to help us. This is going to restore some economic security that we've been missing.
Well, it is certainly true that in many rural communities, a major source of income for people is Social Security and Medicare. Major source of the entire economy. And so building a strong public system that guarantees reimbursement for providers can allow people to essentially pool in those communities and offer a steady source of income for community clinics and doctors. But it's certainly something that we ought to be talking about beyond health insurance, a public health system that is designed to put health care and institutions of health care where people need them. It's
my question, a little bit of a preface to pick up on that last
Tell
thing.
us who you are.
My name is Nick Lento, and I'm from New Jersey. And there's a conflict of interest between, well, first of all, we don't have a health care system. We have a sick care system. I was witness, because I visited her, I was witness to a ton of suffering that was, in my opinion, unnecessary. So many procedures. It came down to bed sores and infections and this and that. And so much of it is driven by profit. I hate to say it, but again, there are perverse incentives to maintaining the status quo. If we really start having a healthcare system, guess what? A lot of the medical industrial complex will start making less money because people will live longer, they'll live better, they'll get sick less, there'll be fewer procedures, fewer surgeries, and they don't like that. They don't want that. Now, I'm not saying these are evil people who are consciously conspiring to keep things as they are because they make more money that way, but what I am saying is that on some level, it may be unconscious, they know that what your agenda is, what our agenda is a threat to their way of life and their profits. And we have to find ways. Now, this is more, it's more of a plea than a question. We, because you guys are the pros, you're the experts, I'm a nobody. But we have to find ways to get what I've just said into an intellectual and policy framework that also resonates emotionally to the American people. That's in my opinion, that's your agenda, your mission, should you choose to accept it.
Thank you. Want to say anything about that?
Your turn.
I'll take a start at it. I think we're going in the exact wrong direction right now. And when we have higher co-pays, higher deductibles, health savings accounts, We are discouraging people from doing just what we want them to do. We want them to go to that health clinic earlier. As Roger said, we want it to be taking that health clinic and putting it into the school and putting it in the workplace, making it more available. The problem is not that it's being overused. The problem is that early detection is being underused. And right now we have a system that's going in the wrong direction. Make that part of a core requirement.
And let me just say to the gentleman from Idaho, the linkage between the rural communities that you talk about and the suburban communities that are in my congressional district is that these are also places where there is not a commitment to a public health system, a preventive health system. And these are actually connections to rural communities that from a policy perspective, we can actually build on. And so they're not divisions. In fact, they're linkages. And I'd like to see us explore that because as much as there is a lack of doctors and adequate health care in rural communities, the same thing is true in dense urban communities as well.
Hi, my name is Barbara Katz. I'm from Virginia's Brigades, which is a group that started out as Jim Webb's campaign staff. And after his great election, decided to stay together as a new organization to promote more progressive policies and help candidates in Virginia, which we're doing now, if anybody wants to join up with us. Anyway, my question is the following, and it really does kind of pick up on what the gentleman just before me said, and I'd really like to hear from each of you on this. I heard what Diane Archer said about the fact that if we give people a choice, over time it is likely that more people will choose the public option rather than the private sector option. We live in a capitalist society. The private insurance industry is incredibly powerful. They are not stupid. If you know that, they know that. How are we going to address the power of the private insurance industry to prevent them from defeating any plan that we put forward that moves in a direction of a public choice?
Yeah, good question.
Good question. I think that sort of defines what's in front of us for the next, not just 2 years, but the next 6 years or so and beyond. We've got to build up the biggest possible political pressure that we can build for the best possible solution to the healthcare system or comprehensive healthcare for all proposal that the next Democratic president will try to get passed. We have to make that the best that we can. My guess is that in that process we will end up, knowing the political system and the Democratic Party, we will end up with a mixed public and private system where we want to build in the principle of level playing field, no subsidies for the private sector that go above and beyond what the public sector gets. We've got to, and then we're going to have an experiment. If we are also subsidizing the private sector and trying to regulate the insurance industry, as Obama and Edwards would do, we are going to have a huge social experiment. Just as you say, what's going to prevent them from jimmying the system? What's going to make it clear that our public plan is superior if it's underfunded? We have a battle to make it the best that we can so that that public experiment comes out in a favorable way to us. That's just my hunch about where things are going, and the answer is constant education, constant pressure, constant questioning of the principles and the premises of what the next president is going to be doing as they try to redeem their pledge for health care for all.
I think we should probably move on. I think there's a great answer.
Oh,
Roger.
but I really was interested in hearing from everybody. Does anybody else have any other thought?
We have
on
less than 5 minutes now.
Anybody, any of you have any additional thoughts? And if not, I'll move on, but, okay.
Hi, my name is Betsy Podlack. I'm a New York artist. I actually was at Ned Lamont's primary victory party, I just have to say.
Great.
It was really fun. But I thought he would win, but anyway, a couple things. One thing I think that would really help is to get rid of the myth that America has the best health care in the world. Now, regular people everywhere in New York City, in little towns, they all have to be made aware that that is not true. We need to get out the statistics. We need to get out. And the other thing is, I just went through Sloan Kettering with a relative. There's a whole huge thing, the best surgeon in the world. You can't imagine. All with Medicare. Medicare is great, still parts of it. These people have no idea how many people survived like he did. No stats. No stats. I just went through specialists, $4,000 on top of my insurance, which is $6,000 a year. I paid out of pocket, thinking if you get an expensive one, they'll be good. There's a great quote in the Times: the cost has nothing to do with nothing. Not one of them was right. My regular doctor, $20 copay was right. So they had no clue, no stats. Right. If you had one health insurance, we want privacy, but couldn't there be some kind of stats? Wouldn't that help? You say, oh, another guy got out of pancreatic cancer a year early. You know, well,
Yeah.
We don't have any answers. No one asks questions.
Right. Go ahead, Ned.
I'll give you 30 seconds on that. The reason we don't spend more time on outcomes is because the insurance companies make so much more money making sure that sick people aren't insured and they just insure healthy people. That's where their profit is. They don't spend as much time figuring out the best way to cure people because that's not where the profit margin is.
Yeah, this is another aspect of this question of what's the information. They're going to be gathering lots of information on us electronically. That's part of everybody's rap from Newt Gingrich to the left. They're going to be doing electronic data collection more and more. The question is, who gets to use it for what purpose? Is it for building a database of what works, or is it for selecting who's going to be cheapest to insure and who's genetically likely to not be sick? Yes, ma'am.
I'm Marcia Moody from New Hampshire, a state representative there. I'm on Medicare. And for those of you in the room that are not old enough to be on Medicare, there's a couple of things I'd like to tell you about it. First of all, you have to have a secondary insurance to cover what Medicare does not cover. So you still have to buy your own insurance. It's a single payer plan, and yes, it works pretty well. But let me tell you, when I get my bills after going to a doctor or going to the hospital, I see the doctor has charged me $87. Then you see a line that says Medicare approves $50. And then you see the third line, Medicare paid $30. Now that's where the government has interfered, and this is where the states they've been cutting the states back, they've been cutting the supplements to Medicare, and a doctor who makes or charges $87 and only gets $30 for it is no longer taking Medicare patients. Yeah. They're dropping out, and a lot of the doctors are dropping out of the field because of the insurance companies said, I can't make a living out of it anymore. And I never thought I'd see that happen to doctors.
Thank you. I'm going to ask Diane to respond, and this is going to have to be the last question. Thank you. Before she does, let me say we'd like to collect emails from everybody here if you want to stay on our list for communication about the healthcare project that we are doing. And we'll pass around a sign-up sheet so that people can give us their emails. Diane?
Yeah, I was just going to re-quote what Roger said, that the price of liberty is eternal vigilance. Just because it's a public insurance system doesn't mean it's perfect. You got to work really hard to make it work well. And the good news with Medicare is that the doctor can charge $87, and if the Medicare only approves $50, that's all the doctor is going to get. You're not going to have to make up that difference. And that's okay. And the bad news is that if the doctors all stop accepting Medicare rates, we're in trouble. So that's the pressure we always have to put on a public system, that it delivers fair payments to providers and good treatments for the patients. And I think if you look at Medicare and compare it to private insurance, hands down in terms of access to doctors and hospitals, Medicare wins by a long shot. And so that's what's important to keep in mind.
Thank you all for being here. This is the beginning of a long, long campaign, and it's good that we're all charged up for it. Thank you.